Hello, everyone. My name is Linda Wilson. I am the Executive Director of Shelter Nova Scotia. Very pleased to be speaking to you from Shabuktuk today. I'm also very honored to have been asked to make a few comments on the housing and health crisis as part of the Nova Scotia College of Social Workers Advocacy Day. A little background on Shelter Nova Scotia that grounds my comments, and that is we serve about 1,500 individuals annually. We've got 4 sectors, as we call them. We have community residential facilities that serve people who are transitioning from institutions to day parole. We have 2 shelters that serve people who are unhoused, 2 supported housing projects, and we also do community outreach. With our newest project, I'm going to speak to more, called the Hub, where we have learned a whole lot more about health and housing. It really is nothing new. I'm sure everybody has seen this diagram before. That was created in 1943 by American psychologist Abraham Maslow, and it's called Maslow's Hierarchy of Needs. And if you look at the very bottom rung, the red rung there, speaks of physiological needs, which are breathing, food, water, shelter, clothing, and sleep. And we say at Shelter Nova Scotia, some of the people who we meet along the way aren't even having those very basic needs met. In some cases, all the needs that they're having met are air. They don't have food, they don't have water, they don't have shelter, they don't have clothing, and they have nowhere to sleep. You'll see on the next rung that health is part of safety and security. And of course, the idea of this pyramid is that in order to have self-actualization, which would be experiencing a meaningful, safe, and purposeful life, you need to have all your needs met along the way. Yeah, so it's nothing new. People have been talking about it since 1943. What we already knew after 50 years as a service provider, so Metro Turning Point, which is our shelter in downtown Halifax, has been open 50 years this year, is that social exclusion is a contributing factor and a predictor of housing insecurity and homelessness. People need a place and a space to connect to their community and experience belonging to be successful in their housing. An integrated, coordinated, and holistic approach to supporting people with dignity, compassion, anti-oppressive practice, and a trauma-aware lens is the foundation for better client care outcomes. And when people leave shelter or leave our services and the supports they access while staying in shelter, many individuals are cut off from essential resources. And when it comes to health, we're fortunate to have some health providers who come to our shelters and provide service. When people leave the shelter, or if they've never even made it into the shelter, it makes it more difficult for them to connect, or sometimes they lose those connections, because going into typical health services, which are strained as it is for those of us who are already housed, it's a more traumatic experience for people who are unhoused. As I mentioned, when I started to speak here, since November 2022, we opened a new service that we call the Hub. It's in downtown Halifax, the corner of Gottingen and Kennard. And over the last 13 months, we've learned directly, or I should say confirmed directly from our clients who self-identify the circumstances and supports that would make their lives livable. People require access to basic needs, including showers, laundry, food, and clothing, particularly among the unhoused. People require opportunities and places to belong. Access to foot care is a huge service people require when they're living outside or are transient or are in and out of shelters and other places to sleep. They also require personal care as their health declines. They need access to safer supply when they're using substances, or if they're using substances. Clinical mental health interventions and brief counseling are both services that people require. Affordable, safe, and suitable housing impacts people's health. And we're meeting people who have no none of that in their current living circumstance. When people do find places to live, they need living supports once they're housed to help them stabilize. And they need support to navigate landlord relationships, tenancy laws, and eviction prevention. We have a new project underway that we're working on and hope to have in full swing over the next couple of years. It uses both housing first approaches and integrated services. So what we think is required generally and kind of greatly across circumstances for people who are struggling with housing. There needs to be emergency shelter beds, and within those services, showers, laundries, meals, and case management. There needs to be rooms. Some people want a room. A room is what makes them feel the safest as opposed to a complete apartment. Other people require supported, affordable housing that's permanent, not transitional. And then there's aftercare and drop-in or outreach services for people who might have housing, might be in between housing, to mitigate social isolation while they're housed or if they're unhoused. Integrated services that are going to strengthen that service would be services that are represented in areas of social and spiritual health, physical health, mental health, and harm reduction for some, which would include managed alcohol, safe injection, detoxification services, and recovery support. And of course, there's need for services around extreme weather. As we know, I mean, again, it's not new, and I'm sure nobody on this call is surprised to hear this, that crowded shelters and growing encampments increase the spread of disease and reduce effective health interventions. COVID-19 brought into sharper focus that homelessness is a public health crisis and made it clear that it's never been more important to link permanent housing with healthcare and other forms of support. Nova Scotians are witnessing the circumstance daily and no longer believe this is a problem of other places. We know without the stability of housing paired with services, those with nowhere to go cycle in and out of shelters, correctional facilities, and hospitals, which is inefficient, costly, and most importantly, worsens health outcomes for those whose multiple chronic conditions are exacerbated by living outside. A holistic, coordinated approach is in order to best meet the needs of the vulnerable population. Equality and equity requires advocacy. And I hope that as you learn more about what we do, or if you're interested in hearing more about our new project, that you'll get in touch. Thank you for your time today, and happy Social Work Week.